Hello, lovely viewers. You're welcome to today's edition of the Nutri Time Show. My name is Dietary and I hope you're taking good care of yourself during this time of COVID-19. During our last section, I shared with you approaches or best way to clean your fruits and your vegetables. I hope it was so beneficial to you at your various homes. Our topic for today's discussion is diabetes and its dietary management. Diabetes and its dietary management. One may ask, what is diabetes? So, in simple terms, diabetes is a chronic condition whereby an individual is not able to produce insulin, or sometimes the individual produces the insulin, which is a hormone that is produced by the pancreas, but the body is not being able to use the insulin that is produced by this pancreas. This may be due to a genetic condition, or probably you may be born with this condition, and also a lifestyle that you may be living can predispose you to this condition called diabetes. It's rather unfortunate that during this COVID-19 period, people with underlying conditions are dying because these underlying conditions such as hypertension, diabetes, and the rest can affect your immunity or can reduce or decrease your immune strength. That will make this virus to overcome you, and eventually it may kill you or you may die. Today we are looking at diabetes and the dietary management. According to the World Health Organization, about 463 million people worldwide are affected with this chronic condition, that is diabetes. Let's come to Africa. 19.4 million people in Africa are also affected with diabetes, this same condition. This is very serious. Let's look at these numbers. And in Ghana here, 540,000 people are living with diabetes here. And I said earlier, this condition is chronic, meaning when you get this disease, you can't cure it, or you can't take it away. It will forever live with you. Unfortunately, 60% of these people who are diagnosed of this diabetes, they themselves don't even know that they have diabetes. It is so sad. So for instance, when you take 100 people, out of the total number, 60 of them don't know they have diabetes. It's only 40 who do know that they have diabetes. And the thing is that early detection of this condition, diabetes, is very key, because the earlier we're able to detect you of this condition, the earlier we can also help with the treatment and the management. Untreating this condition can lead to several complications that we'll be looking at it later. This is so serious. Diabetes. So as I was talking about how one can contract this condition, it may be genetics. That is when you are born with this condition. That's when you are not able to produce the insulin. So that is genetic. Also, lifestyle can also predispose you to this condition. Example of this lifestyle habits are eating of foods that are unhealthy, junk foods, carbohydrates, foods that are so refined. Talking about carbohydrates, it's advisable that you take most of them that are fiber rich, unlike the refined carbohydrates, like the minerals, carbonated drinks, eating of those junk foods, oily food, fatty foods. Also, sleeping early after eating. Immediately you finish eating, then you are sleeping. No. Also, sedentary lifestyle, not engaging in physical activity, no exercise. All these things can predispose you to this condition called diabetes. So therefore, it's advisable that you desist from this habit. Otherwise, you may predispose yourself to this disease condition, diabetes. So one may ask, how will I know that I have diabetes? When you go to the hospital for screening or for test, we have ranges, that is the blood glucose ranges, that when they test you, it will tell you whether you are having a normal blood sugar or your blood sugar is above the normal. So before you eat in the morning, let's for instance, you go to the hospital and you've not eaten. Testing your blood sugar, the range or the amount or the reading you're supposed to get is less than 5.9 millimole per deciliter. 5.9 millimole per deciliter. It should be less than that. Anything above 6 millimole per deciliter means you are getting to diabetes or pre-diabetes. That's what we call 6.0 to 7. It is a range called pre-diabetes. And above 7 millimole per liters, that means that you are having diabetes. That is when you have not eaten in the morning. Later in the day that you are done eating, upon testing your blood sugar, the normal range or the normal sugar level should be less than 11, or anything above that means that you have this condition called diabetes. So it is advisable that one of the days that you are having your birthday or any of these occasions, you pass by the hospital and you check your blood sugar. It is not always that during your birthdays you will be having party and the rest. Go and test your blood sugar. It's very, very helpful. Trust me, it will help you. So let's look at some of the signs or the symptoms of diabetes. When an individual is having diabetes, the person may sometimes be experiencing frequent urination. That is, urinating a lot in the evening when you are sleeping. You wake up like 5 times or 6 times in the night to go and urinate. Also, you'll be having frequent tests. That is, you'll be feeling thirsty frequently because remember, you are urinating, so you have to replace it. And other factors that will cause you to be having that frequent test. You'll be feeling for water. Also, you'll be feeling hungry frequently. You'll be eating more often. Sometimes too, you'll be having that numbness of your lower extremities, your hands or your legs. These are some of the things that will show that you have diabetes. So take note of these ones. There are more that going forward we shall look at them. So let's look at the consequences of diabetes. One may ask, after all, if I don't go and test whether I have a normal blood sugar or abnormal blood sugar, what will I benefit, or what will be the challenge? One, without knowing that you have diabetes, or one of the consequences of diabetes is that it can lead to blindness. Yes, retinopathy. It can lead to blindness. It can also lead to heart failure. Diabetes can lead to heart failure. Also, this diabetes can also lead to stroke, and sometimes too, because of the problem that the issue of diabetes comes with the nerves, it may destroy your nerves, and sometimes it may lead to the cutting of your lower extremities. That's your lower limbs, your legs. They can cut your legs because when an individual is having diabetes, the wound is not able to heal. So when you have a sore, it will just continue to be expanding. That's, the sore will be increasing in size, and later you will have to cut that part of your body off. As a man, if you have diabetes, you will have low sexual performance. Yes, low sexual performance. You are scared. Don't be scared. That is true. You'll be having low libido or low sexual performance. Sometimes there is erectile dysfunction. Yes, to an extent, your manhood cannot perform to how it's supposed to be. These are some of the things that can happen. And don't forget, diabetes kills. It kills. According to WHO, this is the 7th condition or disease condition that kills a lot of people in the world. So you just have to be careful. All right, let's look at the dietary management of diabetes. But before we get to that, I need to tell you that your nutrition is your health, and your health is your wealth. So you can't play with your health. Let's look at the management of diabetes. I said earlier some of the things that can cause this condition. Lifestyle. So in case you have attained or you've gotten this condition, what should you do, or what can you do? You have to seek for medical attention. With diabetes, you have to seek for medical attention, because during the treatment and the management, we may sometimes be giving you medications or the insulin shots. People who can produce the insulin, we give them the insulin shots, and sometimes we give them medication as well. And healthy eating, that is why as an individual you should have a family dietitian, or you should have a dietitian, a personal dietitian, so that this individual or this professional can help you in general nutrition. So the dietitian must help you in the management. And please, the management of diabetes, it is not one for all. It's not a blanket. It is tailor-made. We give management or treatment based on your health or your condition. So let's say if I'm going to treat Amma of her diabetes, the approach in the treatment is going to be different from the approach I'm going to use to manage Kofi with his diabetes. So take note. What we are discussing here, they are general information. So if you are diabetic and you need our intervention, go to any hospital that has gotten a dietitian to help you with the management. But in general, you have to reduce the intake of refined carbohydrates. Make sure most of your food are fiber rich. Fiber plays important role in the management of diabetes. So for instance, if you want to eat your bread, avoid the intake of white bread, sugar bread. You can be taking wheat bread, and even with the wheat bread, sometimes the quantity of the wheat in it is very low, so you can add some amount of vegetables to it. But days that you can't afford the wheat bread and you want to eat the sugar bread or the tea bread, I will advise that you get your vegetable salad aside. Then you enjoy it together. Your vegetable has fiber and other micronutrients that will help you with this condition. Also, avoid eating so much food at a time. Reduce the intake of food. With diabetes, you have to reduce the portion sizes. Half of your plate should come from vegetables. Yes. And also, you can't do with the intake of food that has so much oil. You have to reduce the amount of oils in your food. So you have to take the oils that are healthy, those that you can get the omega-3 fatty acid and the rest. Avoid the intake of this fatty meat. I would advise that you go for lean meat and fish and the rest, or the legumes or the plant-based proteins. They are also very healthy. You also have to engage in physical activity. Exercise is very key in the management of diabetes, especially those who are overweight or obese. You have to engage in physical activity, because trust me, it's going to help you. Physical activity is also important. You also have to avoid the intake of carbonated drinks and caffeinated drinks. Drinks that are on the market, they are full of sugars. It's not advisable. If you want to enjoy a drink, you can go for fruits and you blend it and you enjoy it. And even with that, there are precautions. You can't blend any amount of fruit and enjoy, because the dietitian said you should take fruits. Also, you can be eating fruits. In this management, fruits and vegetables are key. And please, for your information, diabetes, people think that when you have diabetes, you can't take sugar. No, that is not the truth. You can take sugar, but you need to see a dietitian first. He will guide you on how best and how much you can take, that is for the sugar, so that you can enjoy your food. With all this said, I want you to take note of this important thing that I've said. Early detection is key. So visit a nearby hospital to test for your blood sugar. Early detection is key. Physical exercise plays an important role in the management of diabetes. Healthy eating is also important. It's very, very important in the management. And also, if you are on your medication, make sure you follow your medication. Don't do away with the medication. And at a point when your sugars are getting better, don't think, oh, it is okay, so I'll stop taking the medication, or I'll stop living the healthy lifestyle the dietitian or the physiotherapist told me to be living. continue with it, because I said it is chronic and it can't be cured. It will forever live with you. But with the proper management, you will have a normal blood sugar level. Because we don't want you to get into the complicated stage or the complications. The complications are serious. That's what I spoke about: the amputation of the legs, the blindness, kidney problems, the heart problems, strokes, the death, and then erectile dysfunction, and all those ones. So today we've learned about diabetes and how to manage it. You can contact dietitian Kaz later with the number or the contact on your screen for any information on diabetes or anything that you may need, any question or any problem you may have. Contact dietitian Kaz and he'll take you through it and you'll be fine. My name is Clement Akono Sechi, and until next time, this is the NutriTime Show. Please like, comment, subscribe to our channel, and hey, bring your comments. Comment down below, and you'll be answered. Thank you for joining me for today's section. Always remember, your nutrition is your health, and your health is your wealth. See you next time.